This is Andrea Gregg, and you're listening to Death Talk Canada. Here at Death Talk, we're going to be discussing everything death. As a funeral director and embalmer, I'm surrounded by death every day. We will be discussing loss, grief, trauma, dying, palliative care, the MAID program, and the funeral industry. This is for anyone who's ever suffered a loss, who lives with grief. My hope is to help you in some way by shining light on these difficult topics. Thank you for listening. Hello, Prima, and thank you for joining Death Talk Canada today.
Thank you so much for having me, Andrea. It's good to see you again. We used to work together way back in the day, so yeah.
And I thought my time there was absolutely fascinating, and that's why you were one of the first people I thought of that I wanted on this podcast, because I think there's just so much information needed and so much unknown about what the medical examiner service does for people. Maybe you can start off by just talking a little bit about your background and what led you into working with the medical examiner service.
Sure. So I guess I've had a few different roles since starting with the ME service. I started off as a summer student while I was pursuing my education in forensics. So I was hired on at the Victoria General Hospital in Halifax as a morgue attendant / lab assistant. So before the Nova Scotia Medical Examiner Service opened their new facility in 2012, they rented and shared the morgue space at the BG Hospital through Nova Scotia Health Authority. So I was technically employed by Capital Health, but I was serving the needs of the medical examiner service because it was a shared space. So my time was often split between working in the morgue and working in the anatomical pathology lab. And initially my duties were very basic administrative. I was answering the phone, I was receiving bodies, disposing of tissue, inventorying supplies, ordering supplies, again, doing very basic level things. I was only supposed to be there for a few months, and then they kept me on as a casual employee. So during that time, and over the 3-year period that I worked there, I eventually started to train to do autopsy. So I worked with 3 older men who were in their 50s and 60s, and they took me under their wing. And I'm pretty sure the first week that I started there, they all had bets that I wouldn't last through the week. And then eventually we got to know each other and we got along really well. And they were like, you seem suited for the work. If you're interested, we would train you on autopsy procedures. And of course I said yes. And then my role changed a little bit. So it was kind of a gradual exposure to autopsy pathology. So initially I was just setting up the instruments and the autopsy suite for autopsies. I was observing cases, collecting toxicology, eventually removing clothing and valuables from the body, doing photography. And then within a year, I was fully trained on the evisceration procedures and special dissection techniques. So yeah, I initially started as a summer student. And then when the new medical examiner facility opened in 2012 in Dartmouth, it was really just perfect timing. I had just graduated. At this point, I was trained. I had experience in the field, and I started my career there as a forensic technician. And I did that for about 13 years. Yeah. So obviously, as you know, having been in that role for a little bit, the majority of the job is spent doing autopsies. But we also assist with things like going to scenes and assisting with the recovery of remains and on-scene evidence collection. We help with the identifying the decedent. So maybe that's collecting DNA, assisting the police with fingerprints, taking dental x-rays or regular x-rays to see if there's any hardware to make a comparison that way. We're also responsible for the preservation of evidence. So everything from labeling, collecting, documenting, storage, shipping out if it needs to be consulted or sent somewhere, and its eventual destruction. So yeah, I was in that job for about 13 years. And then following the pandemic, my title changed again. So I took on more of a management role. So currently I'm the manager of morgue operations, and essentially my job is to lead the autopsy team and lead the operations for the morgue for the province.
Wow, good for you. There's nobody better for that position than you. And I certainly learned most of my experience there was through you too. And you were always excellent at your job there. Maybe you could explain for people who don't know, how do people who've passed away end up in your care?
Yeah, so the Nova Scotia Medical Examiner's Service investigates deaths of persons who die from criminal violence, by suicide, by accident, if unattended by a physician in a correctional facility, or in any suspicious or unusual manner of death. And we are governed by the Fatality Investigations Act. A lot of people think too that age is a factor. So essentially, if anybody dies under the circumstances that I just listed above, you would come into our care. And that includes anything that we receive, whether it be an infant to the elderly to any age in between. I think a lot of people think, when someone is old and they pass away, it's expected and natural. But as you know, old age isn't a cause of death. So we do have to investigate, and an autopsy would be performed in those circumstances.
And that's what I often say to families. I basically say any unexplained death is usually a medical examiner case because,
Yeah,
of course, you need to make sure how that person passed away to make sure nothing nefarious happened or, yeah.
100%. A lot of people think, oh, it's barbaric to perform an autopsy on someone who's so little, but ultimately you have to explain why they died, and oftentimes it can be preventative. So it's really important that we capture that information, and we have that data, and we can provide closure to the family. So yeah, age is not a factor. Like I said, if they fall within those circumstances, they will come into our care. And then a body is brought in through body removal services. So depending on where that decedent died, they would be brought in from, it could be their home, their workplace, in a correctional facility. It could be outdoors, if it was a MBC, the body would be brought in from, the scene of the accident, on a cruise ship, in a hospital. So we get people from all over the province, and also from many different types of scenes, essentially, where they had died.
Yeah. And even nursing homes sometimes.
Even nurses, yes.
Yeah, absolutely. And again, could you explain for people who may not know what the difference is between a coroner's service and the medical examiner? Because of course, a lot of provinces in Canada do have a coroner service. And
Yes.
I've always said that we're very lucky in Nova Scotia to have the medical examiner service. Could you
100%.
explain to people maybe what the difference is?
Yeah. So oftentimes the title of coroner and medical examiner get used interchangeably, but essentially they represent very different systems for investigating death. Medical examiners are physicians, so they've actually had specialized training in forensic pathology, and coroners are not physicians. So they can request that an autopsy be performed, but they essentially don't have the autopsy training or skills themselves to do it. So the exception is in Ontario and PEI. So coroners in those provinces are required to be physicians. And every province uses a different system, and every province has different legislation and mandates that determine the way that they handle and treat death investigations. So there's a lot of variation in which cases are accepted and what kind of autopsy is done. So in Nova Scotia, for example, we do full autopsies on everybody. There are very rare occasions where we'll just do an external exam. We also do full autopsies on motor vehicle accidents and suicides, or in some provinces, they may only do a partial exam or a external exam. In some provinces, if it's a suspected suicide, they'll only do toxicology, so they won't perform the full autopsy. And some places don't even autopsy motor vehicle accidents. So there is a lot of variation, and I find it can be confusing and frustrating for people to understand the differences. And it also creates a lack of standardization within the industry. So yeah, there's kind of a lot of gray area and inconsistencies amongst the different systems, for sure.
Yeah, and I've always thought of that example, if somebody does pass away in a car accident, well, how do you know if somebody was drinking or on drugs or, if you're not investigating that and finding out for sure, it could make the difference legality wise in some situations. And talking to colleagues in other provinces, it's always been shocking to hear the huge differences, and it's kind of in the industry, we all laugh and say, oh, in Nova Scotia, that's definitely an autopsy. That's definitely going to be an autopsy. But
Yeah,
again, that's a good thing because nothing's going to get sort of slipped by.
yeah,
Um, that could potentially mean something, if nothing else, legality or just the peace of mind to the family, as you've said, to let the family know that no, it was just an accident, there was no drugs, no alcohol on board, or whatever the case might be, right?
yeah. And even investigating it could change the cause of death. So maybe it was a suicide. Maybe there was a natural event that had caused a car accident to begin with. So a lot of these things make an impact because all of the data that we collect, all the death statistics that we have get passed on to public health, and that really affects the funding and course of how public health,
Yeah.
you know what programs they're or what education or resources are putting their money into based on the data that we're collecting from the trends in caseload. So yeah, I feel very fortunate that Nova Scotia does have this system, and it's comforting to know that no matter what happens, it'll be a thorough investigation and you will get the answers that you're essentially looking for. Yeah,
Exactly. I think, yeah, we're so fortunate for that. And if I remember correctly, the medical examiner building there in Dartmouth was essentially built sort of as a clone from the Miami medical examiner office. Is that right?
correct. Yes.
Yes, which
Yeah,
is phenomenal that little Nova Scotia has that kind of technology and that's amazing to me.
it is. And everyone who visits our morgue, even from other medical examiner or coroner services, they're always in awe of the facility. It's so well built and structured, and the space that we used and rented at the hospital, like it was just night and day.
Yeah.
So the space is bright, there's windows, the building's separated, so smell isn't traveling from the administrative side to the morgue side. We have a beautiful courtyard that we can use for getting together with the team and having social events. So it's a beautiful space, and
It is.
it's so specialized to what we do. So we're very lucky to have it. And we're very lucky to have a chief who had the insight to, I know he fought very hard for many years to get the funding for this. So
He
we're
did.
very happy here.
He certainly did. And it's an amazing facility, like that outdoor space, like you said, it's a beautiful spot that people would probably be surprised to see how nice it is.
Yeah, it doesn't look like a morgue, which I think
No,
it
not
shouldn't.
at all.
So yeah,
Not at all. Clean, clean, clean.
yeah.
So when there's a suspected homicide,
Hmm.
how is that different than a regular autopsy? Like the forensic sort of homicide autopsy was always performed a little bit differently when that was suspected. Could you
Yes.
maybe explain how that happens and how that goes down?
Yeah, for sure. So, because of the legal nature of the case, obviously it's treated very differently. With these deaths, we collaborate with the police. So, we're working alongside each other from start to finish. So, from the time the death is reported until the time the body is released, we're in constant communication about the status of the case, important information, evidence that needs to be collected, that sort of thing. So, suspicious and homicide cases are unique in that they require a lot of documentation. Um, so more evidence is being collected. You have to avoid cross contamination. You have to ensure chain of custody procedures are being followed. Um, you have to be especially careful with confidentiality and holdback information because those things can compromise the integrity of the case. And, if it goes to trial, that can definitely be compromised. So those factors come into play. Um, Full body x-rays are also performed for most of these case types, and we collect a variety of trace evidence as well. So that includes various types of swabs, fingernail clippings, hair, fibers. Police often do their UV light inspection as well when they're at our facility. And depending on the case type, so if it was a suspected shooting or stabbing, for instance, depending on the amount of wounds, you're documenting, measuring, photographing all of those wounds. When the body is opened, you're trying to locate, so if there are projectiles, you're trying to locate the projectiles, which can be time consuming because we often use an x-ray to kind of get a relative idea of where the bullet could be, but it's just a guide. So oftentimes you're digging, and if it's lodged in tissue or bone somewhere, it is time consuming in that respect. And again, depending on the case type, there could be special dissections that you have to perform as well. So you could do layering of the skin, layering of the neck, and anterior, posterior spinal cord removal. So there's different approaches and dissection techniques that may come into play, again, depending on what type of case you're looking at. These cases are also extensively photographed. So for a routine autopsy, we have standard photos that we take. And for homicide cases, there are probably hundreds of photos that are done to, again, capture everything that the medical examiner needs, that the police needs to do their investigation. The evidence too, so all of the clothing and valuables are photographed and documented very extensively than a routine case. So we put them out on brown paper. The police or our forensic photographer will capture them through photograph. They make note of the label, the size, if there's any, if it was a shooting and there's holes in the clothing, again, that's being measured and photographed in fine detail. So it's just capturing everything based on the legal nature of the case. So these cases are quite time consuming. And because of the evidence that we collect, we eventually pass it on to the police. So we have to make sure that everything is labeled, categorized, collected, bagged separately. And then at the conclusion of the case, we need to make sure that our chain of custody forms, our exhibit forms that include all the evidence are accurate, that they're signed and dated appropriately before we do that handoff to the police.
And I know from my little time there that the police often will be present during the autopsy as well, just to be witness and
Yes.
observe the details themselves, right?
Yeah, so it really is it's a collaborative effort. Like we're working,
yeah,
again, at the time that the autopsy is happening, they're observing, we're explaining what's happening. They're giving us more information to kind of help guide the investigation that we need to take during the autopsy. So yeah, we're very fortunate that we have a great working relationship with the police because we almost have to be able to do these case types effectively.
Yeah.
Yeah.
Have you ever, I don't know why I'm thinking about this now, but have you ever done what you thought was just going to be a routine autopsy and were surprised to find that maybe it was a homicide and that nobody suspected? Have you ever been in that situation?
I've been in a case where it turned out that it wasn't a homicide, but I have been in a few cases where we're getting started and, you know, the medical examiner is like, something is not quite right here based on the information that we have. So sometimes we'll pause the autopsy, we'll call the police, or sometimes we'll just begin the preliminary steps of how we treat a suspicious case. So we would start doing swabs, fingernail clippings, photography,
right,
all that extra stuff we will start to do just to make sure our butts are covered and we have evidence we need. Because once that body is released, there's no way to capture that information. So we really have to be diligent and sure of ourselves that we have everything collected before the body goes.
Yeah, exactly. Makes sense. And you had mentioned sometimes you just do sort of a virtual autopsy.
Mm-hmm.
Could you explain what that is and why you would opt to do that in some cases?
Yeah, so virtual cases are, an autopsy isn't performed, but the death certificate is filled out and completed by a medical examiner. So in these cases, they're often natural deaths with an abundance of medical history, but no available physician to complete the paperwork. So essentially, there's no police concerns. The identity of the decedent is known. The scene is benign. There's no conflicting theories about cause and manner of death. There's no accusation of wrongdoing, etc. So we do get a fair amount of virtual autopsies, but essentially, cause of death is for the most part already known based on the medical history. There's just nobody to complete the paperwork. So that's where the medical examiner comes in, completes the paperwork, and we don't need to look at the body or perform an autopsy based on the medical history.
That's right. And I know sometimes with the families that I work with at the funeral home, and as well as some of the funeral home staff that I've worked with over the years, sometimes there's frustration or confusion about why the medical examiner's office has not released their loved one yet, and sometimes why a funeral has to be held off another couple of days. I know that there's very important reasons why that is, but could you maybe explain to people who may not know some of the situations that might cause a little bit of a delay in that release of somebody?
Yeah, absolutely. So number one, and part of our mandate is we have to make sure that the identity of the decedent is known. So if somebody comes in and they're tentative, they're unidentified, we have to go through the identification process. So we do not release any decedent until that process has been complete. So oftentimes, if the body's not being released in a timely fashion, it's because it's likely an identification issue. So we're probably waiting for a DNA profile to be generated. We're waiting because our investigators will have to call around to see if they have dental records that can be used for comparison. So we need to find out we have the dental records first, and then we can go in and do the dental x-rays. If they'd had prior surgeries or any hardware in the body, again, we would do regular x-rays to make the comparison that way. It's hard too because in severely decomposed bodies, sometimes the DNA samples that you take, so the tissue or the blood, may not be viable. So you're waiting 3 or 4 days to get that profile, which may not be able to be generated. And then you're having to go back into the body to take another sample from maybe a different location or a different type of sample. So maybe you're trying bone instead. So again, that can, by the time that happens, that's probably a week into it.
Yeah.
Oftentimes, if you get somebody who's recluse or they don't have any known family members, that severely impacts and delays the process even more so. Sure. Sometimes too, we're waiting for like testing to be complete before the medical examiner feels confident and that they can release the body. In some situations, the body's being held because they just need more information. So they may not feel comfortable signing off on the cause and manner of death. Maybe they didn't receive enough medical information. Maybe they need more information from the scene. Maybe they're following up with family or police to ask questions. So again, kind of what I said before, we have to make sure that we gather everything we can in that moment because we don't have a second chance to do it.
That's right.
So a lot of those things, testing, identification, and just getting more information.
Yeah, and I can think of a couple of examples too, like a house fire. If somebody's sort of unidentifiable because they've been burned, of course, and people don't, I think, sometimes understand that it's so vital for the family, if nothing else, to get the concrete information that they're looking for. And obviously the identity, even though some people might think, well, of course it's mom or dad, but I mean, it's much more important than that.
100%. And you have to, like, we never want to hold up the family. We never want to hold up the services, but we want to make sure that we're doing an accurate and complete investigation. So we want to make sure that in order to do our jobs well, we have everything we need. So oftentimes when we hold the body, again, it's not to put the family out. It's because we just don't have enough information to make that call. So we're just waiting.
Yeah. No, it's such an amazing service that we have here. And I remember when I worked there I was there for, I guess, under a year, and I found it so fascinating, and I enjoyed my time there and learning everything there was to learn. And had I not moved to where I am now, far away, I would still love to be there. I mean, it's such a fascinating place. And I'll always remember the mugs that were there, and they said that we speak on behalf of the dead, or something to that effect, right?
Yes. Yep.
And that is so
actually
true.
Found the mug because I knew we still had it somewhere.
Hey, there it is.
So this is what it is. Yeah, I found it at the back shelf in the kitchen.
And that's always stuck with me because that's such a true statement.
Yeah, and it's really about kind of, obviously, if someone's dead, they can't tell their story. So that is our job, essentially. And it's also a preventative thing. So oftentimes you open up a body and you see something and there's a genetic component tied to it. So you can go back to the family. You can let them know what it is so that they can be tested to hopefully prevent that cause of death for them or their loved ones in the future. And all of this information, like I said, all of the data that we collect, we have so much information that gets funneled into public health and statistics. So it's so relevant, and it helps kind of what's happening in the province in terms of cause and manner of death. What are we seeing? What trends are we seeing? And it helps us pivot. It helps the government and the province pivot and really allocate resources and funding to certain things if it's preventable. But again, the point of the autopsy is to essentially put all the pieces of the puzzle together to tell the story of how that person died. And
such a bigger picture,
It is.
Yeah, absolutely. And I mean, the autopsy procedure itself is huge. I mean, you're looking at every single internal organ, you're taking samples, you're opening the head for people who may not know, and looking at the brain, and it's why is it to that extent? I know the answer, but for people who don't and sometimes wonder, and I know some families just think you guys are just taking a picture or an X-ray, and they can't understand why, the embalmer has some work to do afterwards.
Yes.
And again, it's an extensive process. So could you explain a little bit about what you guys are looking for, and why you take samples, and why you go to the head as well as the organs in the chest and abdomen?
Yeah. So in Nova Scotia, like I said, we do full autopsies. And we do that for a reason. We want to be thorough. We want to treat every case the same, so that if we do see something that's abnormal or inconsistent, we're able to recognize it because we've followed this method for so long. So what happens essentially is body is brought in from the fridge. We weigh it, we photograph it, we capture it through, various forms of documentation. The medical examiner performs an external exam. So things that they're looking for include any scars, injuries, bruising. They're looking at lividity, hair color, eye color. Are their teeth real? Do they have false teeth? Do they have any, devices that you can see in the body, medical intervention devices, any tattoos, abnormalities, things like that. So once the external exam is complete, then we wash the body, we re-photograph the body, and then we block it for autopsy. So autopsies are pretty routine, as I mentioned in our approach, but depending on the case type or the circumstances, our approach can vary in some way. So we may do different testing, we may do specialized dissections depending on, again, the information that we have. So that part is a little bit more fluid, I would say. But once we have the body blocked, we do a Y incision, we collect toxicology, and then we open up the chest cavity, the abdominal cavity, and essentially things that you're looking for is anything abnormal, but also what is normal. So it's a process of ruling things out. And if you see something abnormal, could it be a contributing cause to death? You're looking for fluid. So is there fluid around the heart? Is there fluid around the lungs or the abdominal cavity? You're looking for blood and hemorrhaging and bruising within the tissue and the organs. You're looking for skull and bone fractures. You're looking for things like a PE, so a pulmonary embolism, aneurysms, pretty much anything and everything that, again, like you want to appreciate what's benign, but also what isn't. And then we do a variety of testing. So we do toxicology, histology, microbiology. Sometimes we consult. So oftentimes we can retain an organ. So that could be a brain, that could be a heart, and it's sent for consultation. So basically an expert in that field. We do every organ in the body, from reproductive to neck contents to tongue to brain. And again, that's just to complete a full autopsy to be thorough. Because people are like, why do you take the neck? Why do you take the tongue? But essentially, if you died from choking, that information and cause of death would be lost if you didn't take it. So that's why it's important. A lot of photography, specialized dissections, but otherwise, like the testing can vary, and that just depends on the circumstances of the case. So the information that was brought in from the scene, from their medical history, from, talking to their relatives and their family. And then once the autopsy is complete, we clean the body, we stitch the body up, and then it is placed back in the body bag. We put a seal on it for chain of custody purposes, and then it's essentially pending release to the funeral home.
And I just remembered a case that I worked on as an example of why we still go into the head, even though we might find something in the thoracic and abdominal cavities. I remember there was one decedent that had cancer, I think in the bowel, but then when we went up to the head, there was a huge aneurysm, big clot. Like, so just because you find something down here doesn't mean that there's also not another contributing cause that was the immediate cause, you know. So yeah, it's so thorough, and it's such a blessing that we have that in this province. And I always looked at you, Prima, as somebody who had such an awesome work-life balance. You were always really involved in sports, and you certainly know how to have fun. Right? And I know you and a couple of friends just opened a gym, right?
Yes.
Good for you.
Yeah. I think that stuff is so important, especially in this line of work. And that's why I think what you're doing too, it's so important, because it's one of those industries that's not well known. It's not well talked about. We're very much in the background, but the work we do is very important, and it can be very detrimental to your mental health if you don't take care of yourself. So, that's why I go to the gym. I see the other side of it, and I kind of live my life knowing that it could be my last day, because what you see every day, and I'm sure what you see in the funeral home too, like it's very eye-opening.
We don't know what's going to happen 1 minute to the next, do we?
Exactly.
Well, give a shout out. What's the name of your gym?
It's Core Method. Yeah, so still working with the body, just in a very different way, I guess.
Working on keeping it alive.
Yes, working on keeping it alive and functioning. And fitness has always been that lightness in my life that kind of balances the dark things that happen at work. In this field, you definitely have to take care of yourself and prioritize self-care.
Well, you do an awesome job at that on both ends. Thank you so much for sharing that with us today, Prima. And I really enjoyed my time working with you years ago, and I wish you nothing but the best in all your endeavors, whether it's at the medical examiner office or Core Method. So
thank you so much, Erin. It was great to catch up, and I'm so honored that you chose me and had me on the podcast. And I commend you for doing this. I think it's well needed in this industry.
Thank you so much.